Jasmine. I'm the nutritionist here at Back in Motion.
And I'm Steve. I'm a PTA here at Back in Motion and also a licensed massage therapist and personal trainer.
And today what we're going to talk about is tennis elbow. As we all know, it's pretty common. Right, Steve?
Yes, and Jasmine here ended up with a little case of tennis elbow herself, and today we are going to go through a few different treatments, the way I go about tackling tennis elbow and recovering from tennis elbow, and also helping to keep tennis elbow away or at bay. All right, so first and foremost, one issue or solution for tennis elbow that you can do at home: Dixie cup. Great tool. Fill it with water, place it in the freezer, freeze it overnight. What you can do, ice massage the area. Helps to eliminate inflammation that occurs through the elbow and surrounding inconius muscle, and really the inflammation that is occurring in this area is going to cause the pain from overuse, which really you said you were painting, right?
Yeah, I actually got my tennis elbow from painting the inside of my house. And it took me, 5 months of therapy just to get my elbow,
back normal. All right, so I'm going to have you roll up your sleeve.
Okay.
This is going to be a hypothetical situation where we're going to, the ice massage. What you're going to do, once the cup is frozen, has the water in it, you tear around the top of the cup like so. Okay. Once the ice now is going to be exposed at the top surface, this is going to keep your hands from freezing, and you're going to find out the most painful area or spot on the outside, towards the outside of the elbow, and you are going to just stay there and ice massage in circles. The water that's going to form on the surface of the skin is going to actually help to insulate the skin from potential frostbite. It's going to allow you to remain in that area and not have frostbite occur for a longer period of time. You're going to actually keep the ice on there and circling around in and around that area for 2 to 5 minutes until the area goes through a few different stages. You'll feel a little bit of numbness, stinging, it's going to appear red, and finally, after a few minutes, you're not going to feel anything, in that area at all. So then it's time, done with the ice. All right, that takes care of that.
So what exercises can I be doing then?
Well, first, before we get to the exercise,
okay,
let's go through what I usually do to help take some of the tension off of that area. As we know, the tennis elbow occurs a lot of supination. Bicep is the main supinator, which turns the palm over, and there's a little muscle in here that tends to get aggravated. It helps to assist this big muscle, is the inconius muscle. That is also an accessory or supinator as well, but it's not the main supinator. When you're dealing with a little small muscle, such as this inconius, in comparison to the bicep, it has difficulty with keeping up with the tasks at hand. All right, so also, first starters, I like to